Hi everybody, today's video is about flu, short for influenza. I am taping this in February, and so right now this is all the rage and is top on parents' concerns for things that they're worried about. So let me tell you a little bit about flu, and this will be just a quick overview. It is basically a severe upper respiratory infection, but the way you can differentiate sometimes to help you between a regular cold and flu is that flu has sudden onset. With a regular cold, you may have a scratchy throat for a day or two, then a runny nose for a day or two, increasing cough gradually. With flu, you could be perfectly well in the morning and by that afternoon have 104 fever with shaking chills, but you still have the runny nose, scratchy throat, and cough. You still have regular cold symptoms. And so it's important to differentiate between the two just so that you can be more careful about not passing it on to other people. So the fever with the flu can last anywhere from 4 to 5 days. Remember though, this is a viral infection, and so it's not necessarily critical to get to the doctor to have the flu diagnosed, and we'll talk about some specific reasons you would worry more about rushing right in. So most of the time, if you have a runny nose and cough and it all starts together with the time of the fever, most likely it's a viral infection. Now there's a pattern I want to teach you about that's one of our biggest concerns, both with flu and other viral upper respiratory infections as well. If you start out with the cold symptoms and the fever simultaneously, most of the time that's viral. But then if the fever goes away after several days, like I said with the flu it could be 4 or 5 days, and then you're fever free for several days, and then suddenly a fever returns, especially if it's a high fever, that usually signals a secondary bacterial infection, and that can be more serious, and we would definitely want to see you for that. So I want to talk a little bit about the reason we worry so much about flu. Primarily it's because of people who have compromised immune systems. So the very young, the very old, and those who are on chemotherapy that suppresses their immune system, those people who may be on chronic steroid therapy, like children with ulcerative colitis or Crohn's disease, several different things, primary immune deficiency, several things can suppress your immune system, and they would be more at risk for secondary complications from the flu. Part of why it is nice for kids to get diagnosed, whether they have the flu or a normal cold, is so that they can be all the more careful to avoid those categories of people. So if you were in the office today and I just diagnosed you with the flu, which we can do by the way with a rapid antigen test based on a nasal swab that can be run right in the office, then I would tell you on the way out, please go home and rest and avoid crowds, and don't return to school or work or daycare or any of those settings until there's been no fever for at least a full 24 hours. This is for everybody else's good, so you don't pass it on, but it's also for your child's own good, so that if your child is still busy fighting off this current infection like the flu, their immune system's sort of preoccupied, and so they'd be more at risk for catching another infection from another child if they went back prematurely. Now, let's talk a little bit about how you can prevent the flu. Number one, please get your flu vaccine. Guys, don't listen to this junk out there that says, oh, I got the flu vaccine and it gave me the flu. That's baloney. This is an inactivated virus. This is not a live virus vaccine. You cannot catch the flu from the flu shot. I promise. And remember, little babies, newborns through 6 months, aren't able to get the flu vaccine. So it's important that their caregivers, both parents, grandparents, a nanny, daycare providers, other people who help take care of the baby or around the baby should definitely have their flu vaccine since the baby can't get it yet. Now, once the baby's 6 months old, it can get the flu vaccine, and in the first year of life, it should get a booster dose 1 month or more following that very first vaccination. And then every year after that, it only has to get 1 dose a year. And that rule applies for any children under 9 years. If it's the first year that they got the vaccine, we'd recommend a booster dose. So please protect the babies under 6 months by having your vaccine if you're around them. I cannot emphasize that enough. It is important. It's not always a perfect match year. The flu vaccine is not always 100% effective against the flu, but it does shorten the course, modify the course, and protects the child. And we can't say this every year, but at least for last year's flu season, even though children did catch the flu who had the flu vaccine was extremely effective against preventing death from the flu. And ultimately, You can't ask much more than that from a vaccine if it actually helped prevent children from dying from complications from the flu. So please get your flu vaccine. After that, it's all about careful hand washing, managing that child's mucus and the respiratory droplets that can spread when they cough or sneeze, cleaning surfaces with Lysol or bleach, things like this to kill that virus. If you know one of your children in your home, if you have multiple kids and one of them's positive for flu, trying to quarantine or just keep them away from the other kids to help stop the spread of the flu can be effective. Now let's talk briefly about treatment. There is a medicine called Tamiflu that is an antiviral. So it's important you understand a virus and a bacteria are very different things. Viruses live inside the cells. Bacteria live outside the cell. So treating flu isn't the same paradigm as, for example, strep throat. Strep, group A, beta hemolytic streptococcus, is a bacterial infection in the back of the throat. Antibiotics like good old penicillin or amoxicillin kills the bacteria and you feel better. It's that simple. Germ, kill the germ. It's not the same with viruses yet. Maybe one day we'll have better meds. Right now, antiviral meds have a lot of side effects because they're trying to, at least the mechanism Tamiflu uses is it's trying to slow down the reproduction of this virus. And so it can do many other things, like in children cause a lot of nausea. So it's not been our favorite drug, to be honest, as pediatricians. It is still brand name only, so it can be expensive. It's a liquid that tastes really yucky, and it can cause a lot of nausea and vomiting in children who maybe didn't even have nausea and vomiting with their flu. Flu's primarily runny nose, cough, congestion, body ache, sometimes shaking, chills with the fever. It's not always vomiting and diarrhea. Sometimes they can throw up with it, either from gagging on the postnasal drainage or just swallowing all that mucus. But they don't necessarily do that. So you hate to take a child who wasn't even throwing up and then give them a medicine that's going to cause some nausea. And sometimes in children it can even have neurological side effects such as hallucinations. And so we're not just extremely happy to give it to everyone who tests positive for flu. Not because we don't want to make your child feel better, but we don't want to make them feel worse. So if they are in the high-risk categories, like under the age of 2 or known to have asthma or other chronic illnesses or any form of immune suppression, then we may offer Tamiflu, but then even then if you get home and then it's causing the child to throw up, we would say it's okay to stop it. So then what can you do if Tamiflu is not great? You can try to control the fever to keep them comfortable. It is safe to alternate Tylenol and Motrin if you write it down so you don't get mixed up when you gave what and don't accidentally overdose. You can do all the normal supportive care measures you would do for an upper respiratory infection. Run the humidifier, elevate the bed. If they're under a year of age, saline, nasal drops, bulb suction syringe, or the nose Frida, encourage fluids, monitor urine output, count wet diapers. If they're older than 1, they can have honey and Benadryl. If they're older than 2, you can also use Vicks Vapor Rub. There are all sorts of supportive care things you can do. Chicken noodle soup, lots of fluids, orange juice, vitamin C, just a lot of rest to give their immune system a chance to heal their body and let them get that rest. Don't force them back to activities too quickly. Because they're more at risk for catching and for passing it on. So I hope this has just been a quick, simple overview of the flu because a lot of people are really scared by it right now. Certainly big red flags, dehydration, any respiratory distress, which is grunting, flaring, retracting, that's grunting on expiration, flaring the nostrils, ribs up and down, breathing fast, hard or heavy, decreased urine output, or fever resolved and then returned. Those are all red flags that should need to be seen pretty urgently. Remember, as always, this is general advice, and I just hope this has been helpful for educational purposes. For any specific questions about your child, always call your child's pediatrician. Thanks.